Tuberculosis, or TB, is one of the most common infectious diseases in the world. Each year, almost 1.5 million people die from TB disease, and TB remains the leading cause of death among people living with HIV. The good news is that TB is preventable, can be treated, and can usually be cured. TB can be transmitted in healthcare settings when patients and healthcare workers come into contact with persons who have undiagnosed or untreated pulmonary TB disease. In fact, healthcare workers are 1 to 14 times more likely to be infected with TB than the general population. As a healthcare worker, you can take simple steps to prevent the transmission of TB in your hospital and thus play a vital role in improving TB infection control in your hospital. In this video, you will learn how TB is spread, who is at high risk of developing TB, what are the types of TB, why TB infection control is important, and how you can reduce TB transmission in your hospital. The procedures shown in this video are based on the 2009 World Health Organization's policy on TB infection control in healthcare facilities, congregate settings, and households. TB is usually spread when a person with pulmonary TB disease coughs, sneezes, sings, or even talks loudly. Tiny particles invisible to the naked eye, called droplet nuclei, pass through the air containing the TB bacteria. These droplet nuclei can't be seen, but they remain in the air for many hours. When someone breathes in the bacteria, he or she can become infected with TB. Many people infected with the TB bacteria never get sick. The infection remains inactive or latent. As a result, 2 TB-related conditions exist: latent TB infection and TB disease. When TB bacteria live in the body without making you sick, it is called latent TB infection. Some people can have latent TB infection for years and not get sick. However, in other people, TB bacteria overcome the defenses of the immune system and begin to multiply, resulting in the progression from latent TB infection to TB disease. People with pulmonary TB disease are considered infectious and may spread TB bacteria to others. It is more likely that TB will be transmitted when a person with TB disease coughs, passes a lot of bacteria into the air, and spends a lot of time with others, especially in small enclosed spaces that have limited air movement. We need to think about which people are most likely to become infected with the TB bacteria and which people are most likely to get sick. People in close contact with others with TB disease are the most likely to become infected. Because of your job, you are very likely to come in contact with people with TB disease, and that puts you at high risk of getting infected with TB as well. Other patients and visitors may come into contact with patients who have TB disease and may also be at risk for infection. Again, many people who are infected with the TB bacteria never get sick, but some people are at higher risk. These include people living with HIV because they are very susceptible to infections because they have a weakened immune system. Other people who are susceptible to TB disease include children, people who have diabetes, cancer, or kidney failure, and those taking immunosuppressive medications like steroids or chemotherapy. There are several types of TB disease. Most cases of TB are caused by bacteria that can be treated with the standard TB drugs. This type of TB is referred to as drug-sensitive TB. But other types of TB are caused by bacteria that are resistant to standard drug treatments. This means that some drugs can no longer kill the TB bacteria. These types of TB are called multi-drug resistant TB or MDR TB. and extensively drug-resistant TB, also known as XDR TB. MDR and XDR TB can be spread through the air from one person to another in the same way that drug-sensitive TB is spread. The only way to tell which type of TB someone has is through drug susceptibility testing. People who get MDR and XDR TB have longer, more complicated treatment and are more likely to die from these drug-resistant strains. Practicing TB infection control in your hospital is critical to protecting patients and healthcare workers from acquiring TB. As a healthcare worker, you are a vital resource, and protecting your health and the health of the patients is very important. Your actions can help reduce transmission of TB in your healthcare setting. Now that you know the importance of TB infection control, let's talk about the steps you can take to reduce transmission. To control TB, there are 4 types of infection control measures: managerial control measures, administrative control measures, environmental control measures, and personal protective equipment, or PPE. Remember, whatever your role in the hospital, you play a crucial part in carrying out these TB infection control measures. Hospital administrators and managers should advocate for the necessary funds and resources to ensure that infection control measures are carried out. They should also establish an infection control committee that meets regularly, ensures that the facility assessments are conducted routinely, develops infection control policies, an infection control plan, and supports worker trainings, identifies an infection control focal person responsible for implementation, ensures supplies are available to support TB infection control activities. The most crucial part of infection control is administrative control measures, which should be implemented by all personnel in the hospital. You should take the following actions. Monitor the time it takes to get laboratory results back to clinicians and take measures to ensure that these results are returned quickly. Ensure that most TB cases are managed in outpatient facilities and that only critical cases requiring hospitalization are admitted. Ensure that appropriate TB treatment is started as soon as patients are diagnosed and prescribed medication, and that patients adhere to TB treatment. Separate and group patients with presumed pulmonary TB, as well as those diagnosed with pulmonary TB, from other patients, especially patients with HIV, cancer, or other illnesses that put them at high risk of developing TB disease. Promote cough etiquette and provide tissues or surgical masks to coughing patients. Implement a visitation policy to reduce risk to family members and others. Implement the routine screening of hospital personnel for TB and provide TB treatment. Now, let's look at actions you can take in your hospital. One important administrative control measure is for the laboratory staff and the infection control person to monitor the time it takes to get laboratory results, such as sputum microscopy, expert MTB RIF, and culture. Additionally, efforts should be made to ensure that results are returned to clinicians promptly, within 24 hours for smear microscopy and expert. Also, the time it takes between having the results and when the patient begins taking TB medications should be monitored. The earlier that results are known and the sooner patients start appropriate TB treatment, the less likely they are to spread TB to others. In addition to initial diagnosis, follow-up sputum smears are important to determine if the patient is responding to TB treatment. TB infection control measures should also be implemented in the laboratory. The type of biosafety requirements needed depend upon the type of procedures being done in the laboratory. Work with management of your laboratory to ensure that a biosafety risk assessment is conducted. The 2012 WHO Tuberculosis Laboratory Biosafety Manual provides additional information. Most patients with TB do not need to be hospitalized and shouldn't be in order to reduce the risk of TB transmission in the hospital. These TB patients can be referred to outpatient TB clinics for their care. Only those patients who require critical care, are severely ill, or have difficulty walking should stay in the hospital. Some patients with MDR TB can be treated in the community if sufficient support is in place and families are educated on TB infection control practices. It is important to follow your national guidelines on hospitalization and decentralization of TB treatment. It is important to group patients by their status as persons with presumed pulmonary TB, drug-sensitive or drug-resistant TB. Be sure someone is designated on each shift for this task. Separate patients who are being evaluated for pulmonary TB or have been diagnosed with TB from other patients, if possible, in their own room or ward. This is important, especially for patients with HIV, cancer, or other illnesses that put them at increased risk for developing TB disease. Separate patients with drug-resistant TB from other patients, including those patients with drug-sensitive TB. If patients with drug-resistant TB must be hospitalized, they should receive care in a facility that is able to provide adequate isolation and treatment. Place cautionary signs outside rooms or wards for patients with presumed TB or known to have TB or MDR, XDR TB. The signs should provide information on what staff and visitors should do before entering the room. Cough etiquette is the practice of covering the mouth and nose when coughing and sneezing to help prevent germs from being spread to others. All coughing persons in the ward should cover their nose and mouth with a tissue or cloth when coughing or sneezing, or cough into the upper arm rather than the hand to prevent the spread of TB bacilli. And of course, wash your hands afterwards. If disposable surgical masks are available, ask patients who are coughing or sneezing to wear them and show them where they should dispose of the masks after use. If the final diagnosis has not been made yet and you are unsure of the patient's disease status, always err on the side of caution by asking the patient to wear a surgical mask, especially if the patient cannot control their cough or is too weak to use a tissue to cover their mouth and nose. Having patients wear surgical masks reduces the risk of TB transmission by approximately 50%, and most patients will comply if you explain the reasons for wearing the mask. Additionally, when transferring patients with known or presumed TB from wards to other departments, it is important to ask the patient to wear a surgical mask or to cover their cough with tissues to reduce the risk of transmission to others within the hospital. If visitors have to enter TB patient rooms or wards, educate them about TB and, if possible, offer an N-95 or FFP2 respirator to protect them from transmission. Ensure that the patient is always wearing a surgical mask during the visit. Family members should be encouraged to visit TB patients outdoors or in well-ventilated visiting areas. Because of their susceptibility to infections, children under the age of 5 and people living with HIV should not be allowed to visit patients in TB and MDR TB wards, but should visit TB patients in an outdoor, well-ventilated space. The last administrative control measure is designed to protect healthcare workers by ensuring there is routine TB evaluation of hospital personnel. All facilities should provide a package of prevention and care interventions for healthcare workers following their country's guidelines. All staff members should be screened for TB at least once a year, and their results documented as directed by national policies. All staff members with TB symptoms should be further evaluated and initiated on TB treatment as required. Treatment should be free of charge. Keeping a confidential list of healthcare workers who develop TB disease helps the hospital ensure that the healthcare workers receive appropriate treatment. It also helps to measure how well infection control activities are being implemented and identify where more efforts need to be focused. Outpatient TB infection control practices are covered in another video. However, good TB infection control can start in the outpatient area and emergency room of your hospital. In these areas, it is important to promptly identify coughing patients. Promote cough etiquette to everyone. Separate coughing patients in waiting areas away from others. Prioritize coughing patients for prompt TB evaluation, diagnosis, and treatment. Environmental control measures are used to reduce the number of infectious bacteria in the air and reduce exposure. They include natural ventilation, mechanical ventilation, ultraviolet germicidal irradiation or UVGI, implementing safe sputum collection, and optimizing use of hospital space and considering TB infection control in renovations or new construction. Using natural ventilation in waiting areas and hallways may be an easy way to decrease the risk of TB transmission. In warmer climates, having a covered outdoor waiting area near the entrance to the triage or admission area is an inexpensive and an effective way to maximize ventilation and reduce overcrowding. Opening windows in a hospital is a simple practice that may maximize cross-ventilation and reduce the number of infectious TB bacteria in the air. In wards with presumed or known pulmonary TB patients, it's important to keep windows open all the time, including at night and during the winter. If mosquitoes are a problem, use bed nets for all patients who sleep in the unit. Examination and consulting rooms in the hospital should be arranged so airflow moves away from the clinician toward the patient and to the outside or in between the patient and provider. This also applies to other high-risk areas such as radiology and the autopsy room. If you work in a TB ward, the door to the unit should remain closed whenever possible to avoid spreading infection to others outside of the unit. Mechanical ventilation is another type of environmental control. It includes use of mechanical airflow systems designed to supply and exhaust air to maintain comfort. Because of their complexity, mechanical ventilation systems should be planned for, installed, and maintained by qualified engineers. Regular maintenance and budgetary provision are needed to ensure that you can rely on these devices to create the required airflow. Ordinary air conditioning units do not reduce the risk of TB transmission, nor do they filter the bacteria out of the air. Their function is to condition the air to be either colder or warmer. Placing a presumed or known pulmonary TB patient in an air-conditioned room with others actually increases everyone's risk of exposure. Where the budget permits, ultraviolet germicidal irradiation, also known as UVGI fixtures, may be placed in the upper part of a room to help clear the air of infectious bacteria. UVGI fixtures should be installed to ensure uniformly high levels of UVGI in the upper room and low or safe levels of UVGI in the occupied portion of the room. Well-designed UVGI fixtures must be properly installed by experienced professionals. If they are not placed high enough in the room or are of poor design, they can cause eye irritation to patients, visitors, and healthcare workers. For UVGI fixtures to work effectively and kill the TB bacteria, They must be regularly cleaned and maintained. They also require continuous air movement from a ceiling fan or other device so that the TB bacteria can be exposed to the UVGI beam. Details on UVGI are discussed in a separate video. Now we'll cover some environmental control measures you can use to make sputum collection a safer procedure. When a patient coughs to produce a sputum sample, thousands of bacteria can escape into the surrounding air. To prevent others from being exposed to TB, sputum collection should be done outside in a designated location away from others. If sputum collection must be done indoors, it should be done in a well-ventilated room that does not have other patients, or in a sputum collection booth specifically designed to extract air to the outside. Sputum collection should not be done at the bedside or in small, poorly ventilated bathrooms, stairwells, or other poorly ventilated areas, because this does not provide adequate safety to other patients or staff members. Hospital staff should ensure that space is used as effectively as possible. TB rooms or wards should be located away from patients who are at high risk of developing TB. TB patients and persons presumed to have TB should not be housed in a general medical ward. In addition, the TB unit and units with patients with presumed TB should house as few patients as possible per room to minimize the risks of spreading bacteria between patients. As a general droplet transmission precaution, more space between beds may slightly reduce the risk of TB transmission. As discussed earlier, wards should have good cross ventilation to move cleaner, cool air into the room at one side and push warmer air up and across to the outside. When hospitals are planning a renovation or new construction, it's important to consult with infection control experts who can ensure that environmental control measures are included in the building design. Key measures focus on location of TB patients, proper airflow, and limiting the number of patients per room. Many of these measures can be implemented at little or no cost. The last TB infection control measure is personal protective equipment, or PPE, which refers to the use of particulate respirators known as N-95s or FFP2s. Particulate respirators cover your nose and mouth and filter more than 95% of droplets containing infectious TB bacteria in the air that you breathe. Respirators should be worn by staff when caring for infectious or potentially infectious pulmonary TB patients and when doing procedures such as bronchoscopy and sputum induction. Surgical masks should be worn only by patients. They should not be worn by healthcare workers or other people who don't have TB. This is because surgical masks offer little protection from bacteria getting inside the mask and into the person's lungs. Whenever possible, healthcare workers should have a yearly fit test of the N-95 or FFP2 respirator. The fit test helps to identify the correct size and the ability of the respirator to seal out a testing solution. This ensures the healthcare worker is effectively protected by wearing a mask that fits correctly. Regardless of the availability of fit testing materials, it is always wise to check the placement of the respirator to your nose and face and check for gaps each time the respirator is worn. Details for fit testing can be found in a separate video. Staff and patients often have concerns about stigma during triage when separating coughing patients from others or using particulate respirators or surgical masks. It's important to be aware of these issues and discuss them with other staff members on how to minimize stigma when communicating with patients. Role-playing with your coworkers can help you anticipate your own responses to patients' concerns in a way that will help them feel safe and at ease. There are some special considerations for TB infection control in children. The same infection control measures used with adults, such as proper cough etiquette and ensuring proper ventilation, should be practiced when children are presumed or known to have TB. Young children are more susceptible to developing TB. However, they also tend to have fewer bacteria and do not cough as forcefully as older children and adults. This means that most cases among young children are not very infectious, although older children with TB can be infectious. Since most children acquire TB from a parent, caregiver, or older sibling, it is important to make sure that all adults with TB disease are asked to bring any children living in their home to be evaluated for TB. Additionally, whenever children are diagnosed or admitted with TB, parents and caregivers should also be evaluated. Prompt evaluation, diagnosis, and treatment will prevent TB from being transmitted to other family members and the community. In review, remember these important infection control procedures. For managerial control measures, work with your hospital administration to establish an active infection control committee and conduct regular risk assessments. For administrative control measures, monitor the time it takes to get laboratory results back and take measures to ensure that these results are returned quickly. Ensure that most TB cases are managed in outpatient facilities and that only critical cases requiring hospitalization are admitted. Ensure that appropriate TB treatment is started as soon as patients are diagnosed and prescribed medication, and that patients adhere to the TB treatment. Separate and cohort or group patients with presumed pulmonary TB, as well as those diagnosed with pulmonary TB, from other patients. Promote cough etiquette and provide surgical masks to coughing patients. Implement a visitation policy to reduce risk to family members and others. Implement the routine evaluation of hospital personnel for TB and provide TB treatment to those personnel diagnosed with TB. For environmental control measures, ensure that air flows freely to reduce possible TB transmission, especially in waiting rooms, exam rooms, wards, and other enclosed spaces. If using natural ventilation, ensure it has been designed for appropriate cross ventilation and the openings are maintained. If using mechanical ventilation or ultraviolet germicidal irradiation, ensure that they are installed by professionals and maintained on a regular basis. Prevent others from being exposed to TB by collecting sputum outside or in a designated location away from others. And lastly, for personal protective equipment, know where to access the N-95 or FFP2 respirators if they are available in your hospital. Also, make sure they are provided to healthcare workers and visitors who interact with TB patients, and ensure that you know how to use them correctly to protect yourself from TB. You have an important role to play in preventing TB transmission, from one patient to another, from a patient to a visitor in your hospital, and to yourself and your family. If you think you may have TB, it is important to get screened and seek care immediately. Although TB is a serious disease, it can be treated and cured, but it's better if it's prevented. People coming to the hospital look to you as a knowledgeable health professional, so you are a role model for good practices. You are in the best position to educate them about TB infection control and to demonstrate good infection control habits. By practicing good TB infection control habits every day, you can make a difference in the lives of people in your hospital, your community, and your country.